Welcome to the Beauty of Breathing podcast, where we explore the wonders of optimal breathing. I'm Renata Nehme, a dedicated mom, entrepreneur, and myofunctional therapist committed to embodying the principles I advocate. Having recently undergone a tongue-tie release and palatal expansion, I'm thrilled to guide you through the transformative journey of embracing the beauty of breathing, effortlessly and through your nose. Let us know how much you enjoy the show by leaving us a review. We are live. Hello, everybody. Happy Thursday night. Let me just make sure that we go live on Instagram real quick. Hang in there. Oh my goodness, look where everybody's talking from. We are about to start. Sorry, a little bit late today. All right, let's do this. If you are an Airway Circle member, please say me. And thank you, everybody. You are the reason why we are able to do this, to stream live our lectures every Thursday night, to raise awareness to airway issues, to bring airway to everybody. So you are responsible for the growth of the airway field. Thank you. If you're not a member yet, please join us. As soon as this comes off the air, I'm taking it off the air and it goes inside our membership. So if you're becoming a member today, you'd have immediate access to tons of other lectures that we have done. We have close to 200 now, and they are really, really, really good. So you do not want to miss them. I actually, before we start, I would like to say something about obviously what's going on in Brazil. You guys know that I was born and raised in Brazil, and specifically in South Brazil, where the floods are happening right now. I just shared a reel a minute ago, and I'm explaining that the size of my state is double the size of the state of Georgia. So it's as if the whole state of Georgia is underwater. It is a lot. There's over 300 cities. Many people displaced. They're not going to be able to go back to their homes because the water is not going down. Just super sad. So I am going to do something with Airway Circle. I haven't prepared it yet, but I'm going to be sharing with you guys that I'm going to give you guys a discount code. And for everybody who's not a member who would like to help, from now until the end of the month, any new membership that come in with a discount, 100% of that money is going to help the families down there. So join me in helping, and of course, you guys get access to our wonderful membership. So you're learning and you're helping at the same time. And I will share with everybody all of the memberships that we get, and 100% of it being deposited to families down there. And now let's start with our very, very special speaker. So I met Dr. Ruan in Houston not very long ago, and we heard him speak, and my jaw was on the floor. I mean, the whole room was like silent because we were so engaged into his presentation. And I am so honored to have him here with us today. So Dr. Ruan is a board-certified internal medicine doctor. He's an author, an international speaker who is the founder of Texas Center for Lifestyle Medicine in Houston, Texas. His goal is to create new health system utilizing integrative medicine approaches to be implemented into the conventional medical insurance model in the United States. Dr. Ruan also founded the nonprofit Physician Transformation Institute as an ecosystem where healthcare professionals can learn purpose, business, technology, and develop a transformational mindset. Today's topic is the skull-brain connection, the airway dilemma in complex cases. Welcome, Dr. Ruan.
Hey, thanks for having me. I appreciate you. And much prayers to those that are in Brazil as well. Noble thing that you're doing.
Thank you. It is very sad. We are definitely helping each other out. The civilians are doing an incredible job. So thank you for saying that. So tell us, first of all, a little bit about yourself. I know that I read your bio, but I know there's so much more to that. So introduce yourself to those who do not know you yet, please.
Yeah, my name is Cheng. You can call me Cheng. It's Dr. Ron for my clinical days, but on the outside, I'm just Cheng. So I was born in China. Came to the U.S. when I was a wee little lad at the age of 7. My mother's acupuncturist, herbal specialist. My father, he's an MD, PhD on the research side. I really had the East meets West sort of deal throughout my whole life. And so that's sort of the way I approach medicine, is trying to figure out like what the root cause is. And a lot of that has led me down this pathway of discovering at first sleep apnea, and then from sleep apnea into sleep disorder breathing, and from that into a whole world that I've really dove into the last 3 years after I started using something called brain mapping, using a quantitative EEG model to figure out what it really is the root cause of a lot of brain and mental health disorders, and later on autoimmune disease, cancers, et cetera, which still all leads back to the airway as well. So that's the short version.
That is amazing. I am looking down everybody because as soon as we go live, I actually share our live in every Airway Circle Facebook group that we have. If you're not aware, we have, I think, close to 30 state or country groups. We call them state chapters. So I like to share on everybody so nobody misses it. Brain mapping, when I met you in Houston, Susie Quintana was telling me about brain mapping. She was like, you have to ask him to talk about this.
Yeah.
So your father had sleep apnea?
Oh, me too.
Me
I think
too.
this runs in my whole family. So ultimately what happened is early on in my when I was a student, medical student, and then ultimately residency, had multiple concussive injuries, which led me down this path of neurological issues, and then mood issues, and then existential crisis issues. And then,
We all have that.
right. And that turned into sort of this self-discovery of what else is really out there, because conventional modern medicine is not going to cut it. And so that's really when I got into this thing called quantitative EEG brain mapping. And it was at a time where I started reading about, well, how do you turn feelings into numbers, right? It's like, I feel bad. What does that, right? Or I have brain fog. What does that mean? I have poor memory. What does that mean? I have ADHD. Do you really? It's like, what does that mean? So it led me down this journey into the realm of something I never thought I'd get into, which is quantum physics, looking at bioenergetics, meaning that bio means body and energetics is the energy. And a lot of our energy is generated and interpreted by the brain. And so this is seen on EEGs, which has been traditionally used to look at seizure disorders, but quantitative EEGs have been developed to look at different parts of the brain, what a signaling is, and then we can relate that to the way that people feel based on where the signal abnormality is. We can relate that to things that you see, like speech impediments, right? Or lack of like finding words, not just speech impediments, but you can't find words, attention, et cetera, et cetera. And so we're able to see these patterns, and these patterns exist in the world of psychiatry. So they're looking in attention ADHD, they're looking at bipolar disorder, et cetera, right? And that's where the quantitative EEG has been since the 1960s. Now, I look at it from the medicine point of view, not just psychiatry, but tying together the body. And I started realizing, wow, I'm really good at predicting sleep apnea, narcolepsy, other sleep breathing disorders by looking at these patterns. And so at that time, this is what, 10 years ago? No, 8 years ago, I created a machine learning engine to actually learn all these patterns for myself. And then I'm like, wow, we're seeing this relate to not just a lot of chronic illnesses, but especially like mental health disorders. So thought in my head that because this quantitative EEG was locked away in psychiatry for such a long time, let's pull it into medicine, pull into neurology, put it into general medicine, pull it into functional holistic medicine, and see what we have here. And then I met this other brilliant guy named Nathan Haas at Institute of Functional Medicine, and then we hit it off, and I just learned a whole lot more about it. And I got into other scans, such as Dr. Daniel Amen, famous psychiatrist, and his work on SPECT, and now we're really and looking at how they correlate together. So it really became this compendium of, you know what, we could turn words into numbers. And not only that, during treatment and then even after treatment, you can see how much people improve. So I started doing pre and post brain mapping on people with different appliances, with CPAP, bypass, etc., right? And correlating with diagnoses. And in June of this year, we'll be at the sleep conference here in Houston presenting the predictability of my engine on narcolepsy. And so we're translating it into these different things. And then that turned into even a bigger project where we started looking at POS and dysautonomia and Ehlers-Danlos syndrome, connective tissue disorders, who all have sleep disorder breathing because they all have those high palates and tongue ties and stuff like that, just from a genetic standpoint. And we're able to now look at population cohort and say that, you know what, these people have these brain patterns. Perhaps they got this going on, right? So it's no longer a guesswork, and that's what the brain mapping has been.
So what is this machine that you come up with? What does it look like exactly?
Well, for quantitative EEG is nothing new. It's like 60 years old.
Okay, but what did you come up with?
Oh, what did I come up with? Oh, yeah. So it's the different way of interpreting it, right? Because it's really been interpreted in neurology and psychiatry for such a long time. But whenever we look at this, we're like, well, what else is really going on? Sometimes we could look at chronic infections, especially chronic sinusitis and periodontal disease, have a specific pattern that we see on the mapping. And so it's the way that I interpret. I even made an online course out of it. It's a way I actually interpret this. We're not just looking at like, inattention and short-term memory and mood and stuff like that. But so much of it really relates back to the airway.
How can breathing, chewing, and body structure impact the brain?
So we think about it, the brain is an organ that is interpreting things at any given time, right? It is the most important organ when it comes to consciousness. Now, consciousness is not created in the brain because even plants have consciousness, right? Consciousness is there; it's energy. Our humans and our human brain interprets it as different things. So that's consciousness. That's sort of the awareness, right? And so what happens is, in order for this engine to determine consciousness, what we have to do is to make sure that we are able to interpret it in a way where it's actionable, right? And so our brain will naturally categorize things normally.
Mm-hmm.
Categorization is basically keeping it so that whenever we have thoughts that come into our body, we can compartmentalize it and categorize it to different things. Now, people categorize things very differently, and we all have different realities, and that's the case. But in order for the brain to do that, it needs oxygen, it needs nitric oxide, it needs to have a carbon dioxide exchange, it needs magnesium, it needs zinc, it needs water, it needs salt, like sodium, right? And so a lot of the brain chemistry and physiology is dependent upon hydration, nutrition, breathing, et cetera, et cetera. But believe it or not, most people think, well, that's because we deliver blood flow to the brain. That's how brain gets its nutrition.
Mm-hmm.
We're wrong. That's not how it works. In fact, we need our sinuses. We need our sinuses to actually help with the brain. Now, the sinus is part of the airway, right? And so you got your ethmoid sinus, sphenoid sinus, and all these different places. And whenever you look at these sinuses, wherever area they're proximal to around the brain, like the ethmoids around the frontal lobe, sphenoids around the pituitary, right? Maxillary around the temporal lobe. Whatever is proximal to that gets affected if you have, let's say, chronic sinusitis, and your mouth breathing a lot, your turbinates are super enlarged, you got a deviated septum, right? Everything's like clogged up. And those parts of the brain start to shrink whenever your sinus is obstructed, okay? And worse off, if you have a connective tissue disorder, you're born with smaller sinuses anyway. In fact, some people are missing their ethmoid sinuses with some connectors, right? And so the sinuses are important because they provide the body with a majority of the production of nitric oxide. And nitric oxide is, I call it the third gas. There's oxygen and carbon dioxide, which you know about. Nitric oxide is what determines the exchange between the oxygen and carbon dioxide. And nitric oxide is required for a body to grow. Nitric oxide is required for memory, to not have Alzheimer's, to not have ADHD, right? And so it's not surprising we're seeing a lot of neurological disorders and then a lot of psychiatric disorders relate to things that are in the sinus. In fact, we learned the hard way with COVID. What happens is that the spike protein attached to the sinuses, it thickens the submucosa and the mucosa, closing off these areas, and people will develop post-COVID syndrome, or as I like to call, acute dysautonomia. And what happens is that these thickened areas become so entrenched and there's very little air moving in. It causes even more mouth breathing, less nitric oxide. People get brain foggy. This is the whole definition of like long COVID. It's got nothing to do with it itself. It has to do with the immune response of airway obstruction. So this is important. Breathing is to the brain, right? And so our ability to move air through our nasal sinus is extraordinarily important, even in ancient civilizations where they used to mouth tape. I guess we mouth tape again now these days. They used to mouth tape babies, right? To make sure they induce air, like an induction. You know, kind of got your car person to ram air intake. You're literally getting air into the nose to create that nitric oxide effect, so our mitochondria or our energy units in the brain can actually do its thing and chug along. And so the entire breathing mechanism depends on the skull. This is why it's called the skull-brain connection, which is the topic of this talk.
Amazing. Anne is asking a question. Can you share some patterns that you are seeing relating to sleep?
Well, that's everything. Everything relates to sleep. In fact, if we can hack our sleep, we can hack a lot of our biological systems and disease states. So the patterns that really relate to sleep, just fair warning, I'm an adult doctor. I don't really see children. And so children, they exhibit different things. For example, in children, there's hyperactivity. When it comes to adults, it's not hyperactive anymore. It's like, oh, it's 1 p.m. Why do I need my 5th cup of coffee? Right? Those are certain patterns. You also have nighttime urination happens in both adults and kids. And people think, oh, no, I'm not sleeping, so I have to get up to pee. It's like, no, you have to get up to pee because your brain frequency is not getting low enough to paralyze the bladder enough where you feel like you have to pee. And so a lot of times we're seeing bruxism, or chewing and grinding, right?
Mm-hmm.
And TMJ issues. Or some people don't even have TMJ issues, but their dentist will say, hey, you look like you grind. They're like, no, I don't. Yes, you do. No, I don't. Yes, you do. Hear that a lot, right? So we look a lot of the teeth and see exactly what that looks like. Sometimes you got people like my face. I have masseter hypertrophy. See that? My masseters are kind of humongous right here. You know, I'm thought it was a nexus. That chronic bruxism since I was a little baby, and not knowing how to sleep apnea, that occurs as well. Another huge one is fibromyalgia. All right, fibromyalgia. I have this written by my friend Linda Harris. It's called the fibromyalgia TMJ connection. Right, fibromyalgia or chronic pain is huge. All of them actually have sleep apnea or sleep breathing disorder. And the way that their bite is, either there's a cross bite, overbite, underbite, something that's causing a lot of oral facial strictures, so a lot of chronic pain. So, and then you have, of course, the forward head posture, doing one of these, you know, I may be preaching to the choir, you know, where the head goes forward, there's a lot of back strain. And then there's those people who says, you know what, I can't exercise, I have the tightest hamstrings. Yeah, tight hamstrings, that's airway obstruction, right? Yeah, because the tight hamstrings are the ones where people have to compensate because of either forward head posture or the sternocleidomastoid is locked to their clavicles so much that they really can't move the rest of the way down, right?
You're talking to me.
Plantar fasciitis is another one at the bottom of the foot where it's like, oh,
Yeah.
a lot of foot issues. Podiatrists look at that a lot. But when you have plantar fasciitis, you have to look in the mouth too. You know, a lot of bruxism can actually create plantar fasciitis. I mean, I can go on and on and on and on.
We are here to listen. No, you're totally, totally fine. If you want to go a little bit more into the topics today, the skull-brain connection, you're welcome to.
Yeah, so I'll tell you that the way that the skull is.
Okay.
Renata, I have my kid in here too, so don't feel too bad.
Yes, I'm actually going to step away to get him food and I'll be right back, but I'm listening. I got you in my ear.
Sounds good. So what happens is that when we look at the skull, all right, so you got your cheekbones connected to all these different tissues in your jaw right here, right? What happens is that if you look at our sternocleidomastoid, which is right here, going from the mastoid process to sternum, okay, a lot of people are kind of tender in this area. And in fact, if you actually press on yourself right now, if you're tender, your posture may be affected. One of the things that the skull controls is your lungs, okay? And so this is sort of a big missing part, is that when your skull is trying to manipulate the airway, especially if you have like sleep disorder breathing, a lot of fascia gets super tight right here. Fascia is sort of the connective tissue with millions of nerve endings that are in there. So the fascia goes down and actually goes down and connects majority of the, well, not majority, all of the something called intercostal fascia. Intercostal means between the ribs, and you literally like lock down. So if you're clenching, your ribs are actually locked down. It's really hard for you to lower your diaphragm, even take a deep breath in. So when people have airway obstruction, they actually have lung obstruction as well. They go hand in hand. In fact, I dare say this, that a huge portion of people with COPD and asthma actually has upper airway obstruction that's triggering the lower airway issues because of this connectivity that's right there. And then the skull also controls your gut digestion. So a lot of times in functional medicine, which is my field, people are like, oh, I got these leaky gut issues and I got IBS and constipation, diarrhea, whatever it is, right? Well, a lot of times that may be stimulated by the way that our oral facial systems are, because one of the things that affects the gut is the vagus nerve. The vagus nerve travels from the bottom of our brain down and goes everywhere, called the wandering nerve, the vagabond. That's how it's got his name, the Vegas bird. It's a vagabond. Vagabond is the wanderer, right? And as the vagus nerve travels down into our neck and going in, one of the things that people don't realize is that the vagus nerve is responsible for the gut functions. Even the microbiome, the gut bacteria is dictated by the function of the vagus nerve. Well, what creates the function of the vagus nerve? Your teeth, your canines especially, right? Canines and incisors right here. So what happened is back in the 60s, they used to shave down dogs' canines, and the dogs couldn't form a regular bite. So what happens is as they bite down, they don't have a good bite force. And they found out that these dogs were having a lot of issues, from gut issues and they were going like feral, they were going crazy. And so in humans, if you got bruxism, or if you have a crossbite or any bite issues or overlapping teeth, and you can't form a good bite, what happens is there's a nerve right here called the maxillary branch to the trigeminal nerve right here. That's supposed to, whenever your bite forms, supposed to go back to your brain and calms the vagus nerve down. Or actually, I shouldn't say that. It calms the body down by increasing the tone of the vagus nerve. And that's how you digest. So a lot of people are like, oh, I'm allergic to this food, and I can't tolerate this, gluten and dairy, and whole 9 yards, right? What happened is that no one's really looking at their teeth and their airway. So these people get labeled different things, such as mast cell activation syndrome and all sorts, and dysautonomia and all sorts of different things, but actually has to do with the way that the bite is formed. That neurologically, they can't necessarily activate their brain to create this triggering mechanism for the vagus nerve to really help the body. And the vagus nerve also calms the brain down. So these people get labeled ADHD, bipolar disorder. The really severe ones get labeled schizophrenia and all sorts of different things because they literally can't calm their brain down, right? And so you see there's such an intimate connection with the skull, the brain, and the rest of the body. And so much of our body systems are dependent upon the way that our airway and skull formations are. And the last thing that I want to get into is this concept. And this concept has more to do with our entire body as an energy source. So what happens is, like you and I, we're talking, we're using our brains, but what happens is, there's always a feeling that you get when you're around some people, right? The unspoken feeling that there is, and that's we call it the subconscious. What happens is that the subconscious triggers a mechanism in our body to also grind down our teeth, right? If we're not comfortable around somebody, something triggers us. Maybe it's a previous trauma or something like that, right? You start going like this, and guess what? If your bite is off, you can't use that to calm your brain. You can't induce that vagal tone. Your brain doesn't calm down either. And so a lot of people with like post-traumatic stress, a lot of the PTSD population, if they have bite issues, that's one of the first things I tell them to do. You got to work with the orthodontist on your PTSD, right?
Wow.
And a lot of them are biting down. Why? Because they have sleep disorder breathing and airway issues, right? Which necessitate the bruxism that's there as well. So it's really, our entire body is sort of an end-to-end system with our mouth and our sinuses and our nose and ribs.
My mind is blown right now. Are you kidding me? Vagus nerve, vagabond, canines. I know that everybody else is like freaking out. Yeah, so validating. Oh my goodness. Cherie's asking, so most chronic illnesses are airway issues?
I wouldn't say that.
Huh?
I wouldn't say that. I say a lot of them are. I wouldn't say most are. I would say that more and more chronic issues are airway. This is because, everyone's a Gerber baby, right? Everyone that doesn't have solid food till like a year and a half these days, right? Instead of at 4 or 5 months that they're supposed to, right? One of my friends, and by the way, I have so much knowledge because I have really awesome friends. One of my best friends in the world is this guy who wrote this book right here. His name's Felix Liao. Y'all don't know.
Yeah. Because we love him. He's spoken for us before.
Yeah, Felix and I feel like feel like he's my spirit human. And I'm really good friends with his son, Franklin. He's a chef here.
Mm-hmm.
And, Felix introduced me to this concept a while back. It's funny because a lot of what I talk about in facial structure comes from his thoughts, which then really got me in touch with a lot of people in airway dentistry, biological dentistry, surgeons like David Alfie here in Houston. He's one of my good friends, right? Chris Chan, the ENT over here, we're buddies. Right there, actually. And so we have this really amazing network here that I really learned from. So I got to give a lot of credit to them because I didn't learn this in medical school. None of this was taught in medical school.
Mm-hmm. So just holding your bite together is in proper occlusion allows the vagus nerve to relax?
I wish it was that easy. So what happens is whenever we're sustaining a normal bite, everything meets together, right? No cross bite, no overbite, no underbite, right? Whenever the bite meets together, it feeds back into this nerve bundle called the Gasserion ganglion. And the Gasserion ganglion goes up into the hypothalamus of our brain. And that's where the origin, also where the vagus nerve comes out of, right? Or the initial area that promotes the vagus nerve. So it tells this area, hey, vagus nerve, do your thing, right? Which is why when you're angry, you clench your teeth to actually calm you down. That's what all mammals do. When you're angry, you clench your teeth to calm you down.
Crazy for me.
What happens when you can't calm down? Because you have some bite issues, right? Then you start doing one of these things. You start trying to figure out, where am I going to put my teeth so I can calm down? And then you do it when you're unconscious, when you sleep, when you do it when you're still.
Oh my goodness.
And that triggers your fascia to be super tight. In fact, this is the origin of fibromyalgia, actually. You trigger your fascia, you just so tight, and all of a sudden you start looking like one of these things right here, right? And a lot of our brain health patients, they come in, when we sit down, I come in and they do one of these, hey, Dr. Ryan, how you doing? I'm like, talk about your brain. Let's first, right? There's a lot to work on here before we even get into a lot of the brain health, because that's fundamental, but that's a lot of that has to do with the bite as well. Not just your body, a lot to do with it.
That is just incredible. So what happens when people get 4 premolars extracted?
Good question. I am no expert in this, but I see patterns, right? And a lot of people with connective tissue disorders, Ehlers-Danlos, do get 4 premolars extracted. It's really common because they don't have ability to deploy specific genes to widen the palate when they're younger, right? It's part of the genetic makeup. And so there's not enough real estate for the teeth, right? And so what happens is when you take away the bracing structures of the mouth, the mandible, or the maxilla, then epigenetically it just kind of shrinks and develop over time, right? And so, that's not really seen as a problem to most, I think, regular dentists, but it is seen in the airway dentistry group. And I will tell you that we take a pretty awesome orthodontic history in my practice, and most doctors, most physicians won't, right? Because I didn't even know what premolars were in medical school. A lot of people who have a lot of these teeth removed tend to have in the brain mapping what's called hypervigilant EEGs, where the brain's like ping-ponging between like go, 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 and then like I'm tired, right? And there's like nothing in between. That's usually the people who have a lot of these premolars removed and have some bite issues as well. I wouldn't say everyone, but it's bigger than that I originally thought.
And when you're talking about people coming down and clenching together, that really makes me think about children, especially special needs children, where, things are happening in much faster rates. I feel like in the brain, all of these ASD kids, and they grind so much. I have heard in our field people say that grinding is 100% airway. And I'm like, no, I don't think it is. There's so much more that we don't know. We can never say 100%.
So I'll tell you, it's not 100% airway, but it is 100% perception, and I'll tell you why. So 100% perception means that like our brain's always receiving signals, right? And those kids who are neurodivergent on the spectrum and stuff like that, like the problem is like you and I, when we learn something, we compartmentalize and categorize, right? We can see things that are important, not important. They just think everything's important, and then they can't calm that system down, and then they rock and they grind. They don't have to have sleep disorder breathing for this. That comes in because of the perception of the brain. Let's call it the consciousness, kind of spiritual that. So something is creating a discomfort within the consciousness. And my most powerful nerves was the trigeminal nerve, is trying to do the best it can to feed back to the vagus nerve. Hey, like kick in, like, start calming me down. And sometimes that doesn't happen, especially in a lot of people with like generational trauma, right? Inherited family traumas. There's a lot of bruxism kind of goes on, but they don't have to have airway issues, right? They have to have that perception, their perceived reality that there's discomfort that's really there to create that mechanism up there.
Oh my goodness. I think it was Lois Lane that I heard talk about, everybody wanting to turn on the vagus nerve and, activate the vagus nerve. Vagus is the new thing. But she was saying that you cannot turn on the vagus if you do not do the other cranial nerves. So you just mentioned, exactly. And then the olfactory nerve is something that I've been focusing a lot with my patients lately. Like, you have to be able to breathe. You have to be, our nose is so important. I had a doctor that spoke.
Yeah, so the olfactory nerve is smell sensing, but your ability to breathe is still the trigeminal nerve. So
Oh my gosh.
has these branches like my hand right here, right? So all we talked about so far is the maxillary branch of the trigeminal nerve. There's the mucosal branch of the trigeminal nerve that senses air velocity to the nasal sinuses, right? They still got back to the same Caesarean ganglia. There's ocular and auricular branch of the trigeminal nerve goes into the periorbital fascia. So you're doing one of these things. So you're squinting. It's also triggering the same trigeminal nerve, right? With your entire face, when your orbits and everything like that. I mean, this is why I always have my blue blockers on me in case I get a little too brain foggy, or one of these things to stop the auricular sensory branch of the trigeminal nerve. To this helps me calm and relax, and it boosts my serotonin as well, right? But the vagus nerve is one part of the story. The trigeminal nerve in your skull is a much bigger part of the story.
Wow.
To ignore. Yeah.
There was a doctor that told me that the olfactory nerve was the most important. That's why it was number one, because of your sense of smell. And
Yeah.
back in the day, in cave days, we were able to smell danger. That's why we were able to go into deep sleep. We were fine. But now nobody can breathe. We have allergies, enlarged turbinates, deviated septums, and we live inside homes. And most of us have really lost our incredible sense of smell. I have it. I can smell anything, by the way. I think I have that condition, whatever it's called. I can smell anything from a mile away. It's a problem sometimes, let me tell you. However, most people can't.
Yeah, so the olfactories are like two little bulbs sitting on top of the ethmoid. And so, sorry, not the ethmoid, the cribriform plate. The cribriform plate separates the sinuses and the rest of the brain. So by the time your olfactories are knocked off, your trigeminal is already like, oh my God, like this is discombobulated, right? So a lot of people will like mold, who get
Mm.
they knock out their trigeminal response. They knock out the olfactory response, and they accelerate towards dementia and brain shrinking really, really quickly. And we see that all the time. There's a paper published by Dr. Dale Bredesen, who wrote the book End of Alzheimer's. And if y'all can look it up, it's called Inhalation Alzheimer's. It talks about this effect where you're inhaling particulates and mold and stuff like that, which knock out a lot of the receptors in the olfactories and the trigeminal nerve, and then the sinuses become impacted, and then that triggers a downstream cascade, and your adrenals mess up, your hormone mess up. It's sort of a big issue, right? And so, but some people are affected and some people aren't. But guess who's more affected by mold? The people with sleep apnea. Right? The
Ugh.
people have even lower airway obstruction, right? And so there is a system here that we have to think about from a holistic standpoint. The airway is part of the bigger equation, but we have to think about the rest of the skull structures, not just the airway, but literally your cheekbones, your septum, and all the different areas as well.
That makes sense to me. We were interviewing Dr. David Gozal some time ago, and he is just incredible. He was talking about how he if you keep waking up these mice, not letting them sleep, so this fragmented sleep will change your gut flora. So if you're not sleeping well, you're being exposed to something that's not good for you. Well, your gut flora is not as good. Well, you're gonna take longer to get healthy.
Yeah.
So that makes so much sense. My goodness,
I have this really unpopular opinion. I don't think the gut flora is really important. I think the oral microbiome is way more important than you actually lower gut flora, because oral microbiome is still part of the gut flora. And the reason I say that is because your oral microbiome determines your gut microbiome, and it's less so the other way around.
okay, perfect. That's good to know.
And in fact, let's say you have a piece of celery in your hand, right? Break the celery, you just swallow it whole, okay? It goes into your gut. Versus if you chew this thing 27 times and then swallow it, your microbiome response to that celery is completely different, right? Your Akkermansia, your Formicity, all the species are quite different, because digestion starts pre-chewing when you're visualizing the food, and you're visualizing the food and salivate, and that's when the microbiome gets this. It's going. But then if you bypass the chewing part, it becomes an issue, which is why in Chinese medicine, my mom hates people being on smoothies. When you do doing smoothies, it completely wets your microbiome for some people, right? And you think you're being healthy, but then you gotta be able to chew. There's still a chewing component that's really, really quite important. Actually, that's all of Eastern medicine, and Ayurvedic medicine is the same way, right? You gotta be able to kind of like chew your food and create that digestion process. It isn't up.
And then let's just
Yeah, I get a lot of slack for it, but that's okay.
and then let's just put food in pouches, because all kids need is nutrition. They don't need to experience anything.
Yeah.
Oh my gosh. Since you went a little bit into mold, I would love to ask you.
Yeah.
Are there any good tests out there? I have a couple patients who know they've been exposed, and they've tested the house, and they mentioned to me that there aren't very good tests about testing yourself. What is it better? Is it better to test the environment? Is it better to test the person?
If you think you have it, you have it. You don't have to test anything. And I'll tell you why. I've never seen a negative mold test in the city of Houston before, ever.
Wow.
We use Great Plains Laboratories before, and then we use Vibrant, all sorts of different things, and then real-time labs. Like the problem is you're going to excrete mycotoxins. These are urinary tests, right? You're going to excrete mycotoxins in the urine. Myco means mold, MyCO. The mycotoxins that get excreted are supposed to be excreted. And so you better have it, because if your test was actually negative, you're probably the most mold toxic of anybody, because you can't excrete the toxins in the urine, right?
Mm.
And so what happens is there's a lot of allergists that do sort of the mold skin testing and stuff like that. That's only testing one arm of the immune system. It's not that great. But the real question is not is there mold or not? There's mold, right? There's mold. The real question is whether or not it really affects you, right? So I'm biased, so I actually used my brain mapping, quantitative EEG, to actually look at that answer. And there's actually specific things that are in there that tell us that. But if you're one of those people that have a fancy cone beam CT, like CBCTs, and you see those really thick mucosa and submucosa, and you see those encroaching nasal septums onto the turbinates, right? You're going to be affected by mold just because there's not enough velocity in the airway to move air, and your submucosa is really large, right? We work with one of my really good ENT friends local to me here, Dr. Michael Kaplan, to work on these sinus patients, right? And lo and behold, guess what happens? Like sometimes people can get sinuplasties and sinus washouts, and then we do the mold test again, and they're fine. They don't really have to go through anything crazy. Sometimes we have to get a little more aggressive. But the mold thing is one of the things that are in the air. There's VOCs, like volatile organic chemicals, that does the same thing. COVID does the same thing as mold, right? There's no difference, right?
Wow.
And even when we did the studies on the first, like SARS-CoV-1, right?
Yes.
That did the same thing as well. And so you have it's all about resilience, right? A lot of our resilience is based on the airway in our skull, and that's true. One of the things that we're doing now is, so I'm an AI nerd, and we actually wrote a program to analyze patient data, something from unstructured data to structured database of what are some things, so we can inquire on our data, which means that, let's say I upload 8 years of data of patients, right? And I say, hey, who's are really affected by mold? I can say that, people who are affected really by mold are the people with AHI of 8 and above on the sleep study, right? Or RDI of 22 or above. Right. Now we can look at stuff like that, which we're doing right now. So I think technology has really come a long way, and now we're able to inquire data we haven't done in a long time, and it's crazy because this is the time where we can ask higher quality questions instead of being stuck in a paradigm that someone has told us something.
Oh, data is everything. Well, what you do with data is everything.
Yeah.
Kim is asking, when working with patients with with facial tension or fascial tension,
Tension, yeah.
how often are you also seeing tongue restriction?
All the time. Have I seen someone with fascia tension without tongue restriction is the question. I don't think so. I think it's always has tongue restriction, right? And it doesn't necessarily have to be a tongue tie, right? It could be underdeveloped tongue. It can also be a lot of glossitis, which is enlarged tongue. Now, granted, some people's tongues appear enlarged because their palate is too small for the normal size tongue. People actually have really enlarged tongues for other disorders, right? Is amyloidosis, which is one of the people think it's rare. It's not that rare. And you deposit protein in the tongue, and you get larger and larger and larger.
Okay, what was that called?
Amyloidosis, yeah.
Okay.
Yeah, there's another one called sarcoidosis. We can have the same thing. But these are autoimmune issues that they deposit protein and collagen in the tongue, and the tongue actually gets bigger. So I know a lot of the airway dentists says, no, it's not a large tongue, it's just the palate too small. That's not all the cases, it's
I have a few patients. I mean, I look at them like, oh Lordy.
Yeah.
Like we know that either, this person is not that transverse deficient or AP deficient. You can tell when there's the increased tongue volume. I really started talking a lot more to my patients and to the Area Circle girls or my Circle girls about increased tongue volume. We really need to use that as, are we going to recommend a tongue tie release or not? I feel like that's more important than anything. Increased tongue volume. We need to start talking about it.
And you probably know as well as I do, tongue tie really doesn't really fix anything, right? Sometimes buccal releases, tie releases doesn't necessarily do anything for the patient. Sometimes it makes things worse. So there are things medically that we have to look at. I'm not getting that today. And there's some hereditary disorders that we have to look at in addition to just the functionality. Like I said, although some of the stuff works in most people, it doesn't work in some of these people. And usually by the time they get to my practice, they're in the minority already that's failed every other option, right? With my practice, they've seen airway, they've seen multiple myofunctional therapists. Sometimes they had jaw surgeries, right? Like everything's like optimal. Like what else is missing? There are a lot of stuff in the back end that still requires optimization in the human body. That's not, it's not like a lot of times it is airway, but then sometimes it's not. And then you have to figure out, there's a lot more individualization on the back end as well.
Dr. Tran is here. Hey, Dr. Tran. Yes. Surprisingly, in Colorado, where we have a very dry climate, we have lots of mold. I have patients test all the time. It's very impactful. So there are options to treat mold.
So Colorado, even though there's drier, there's a lot of air movement. There's transitions. They're based on the elevation. So Colorado is a big area. Whenever you have these humidity transitions, different mold species get aggregated, But yeah, Colorado, that's true. Whereas in Arizona, you don't have a lot of that. But then they have other problems like mercury and dust storms. Like they have other problems. No matter where you are in the country, there's some sort of toxins that can get aggregated. Yeah.
And it's saying, is food sensitivity testing or genetic testing something that you find helpful to help manage and support patients with food sensitivities, intolerances, or are those tests not very useful? That's a great question.
So their popular opinion, I don't think anyone should really get food sensitivity testing. I'll tell you why. Because if you test on a Monday, Tuesday, Wednesday, and Thursday, all 4 days, it's going to look 4 different tests. I'll be honest.
Really?
Because I used to do it, right? I used to prescribe this all the time. It's honestly a waste of money. And I'll tell you why. On Monday, you do the testing. You get result A. Monday night, someone texts you, receive bad news, you slept 4 hours, and you wake up the next morning, your test results look completely different because you only slept 4 hours, right? And then that evening, you get consolation. I'm going to go to sleep. I had a good big cry, feel pretty good. And that next day, all of a sudden, your sensitivity goes to 0. Your IgG, IgA goes to 0 for foods, right? Because you had good quality sleep and you had emotional release, right? On Thursday, you go into this sort of bereavement, and then you're like now eating a bunch of different things and stuff like that, and then your test goes different. My father's MD PhD, but his PhD is in blood assay development. So one of the things we look at blood assay development is consistency, right? Not just a cross section in time, but consistency. My issue with it is that we get patients all the time that's eliminated down to like 3-4 foods. We're like, what am I going to eat? I was like, well, before that, first of all, are you drinking smoothies or are you chewing? All right, that's number one, right? Number two, if you're eating, are you eating in a time where you're go eating in the van or with your kids, like going to like gymnastic practice, or are you calmly sitting down? Because you're calmly sitting down, you're not going to form the immunoglobulins that you see in the blood work for the food, right? Number three, what's the weather outside, right? If it's a little muggy, like today's super humid in Houston, your sinuses all clogged up, yeah, your IgG, IgA in your gut's going to go crazy because it's supposed to, right? So it's looking at a cross section in time, but it's the one test that creates a lot of complexity that impedes progress, right? So instead, we should be looking at, okay, if I do have food sensitivities, let's say you get a really well kit or whatever, you do your blood spot, you have food sensitivities. Think about life. Like, how am I breathing? What's going on? Am I sleeping? Am I hydrating? Oh yeah, dehydration also causes the food sensitivities go rise as well, right? You have too many factors, the fundamental factors of life that are there that creates the sensitivities. And then you have the placebo effect. So if you believe you're allergic to almonds and you eliminate almonds for a year, you do the food sensitivity again next year, almonds are still there. You're like, shit, I eliminated almonds for a year and it's still there. Your brain can literally create these immunoglobulins based on memory T cells, right? That will stimulate the B cells, which create these antibodies to be created. This is my major in Texas A&M is immunology and microbiology. So this is my favorite topic right here you're talking about. Well, our body are supposed to build these antibodies because if it didn't, we'd be dead. There's genetic disorders where we have no sensitivities. You don't hear about them because they die at the age of 3 months. They don't exist. And then there's other disorder that all of a sudden you get no immune response. It's called AIDS. You die there too, right? And so like people are seeing this autoimmunity or this inflammation as a bad thing. Well, what that autoimmune inflammation, neither of us would exist right now, right? So we have to have that happy medium. This means I go back to the airway still. If you're having a lot of food sensitivities, like what's going on? Like show me how you're taking air into, either of your nostrils, right? To be pressed to your face. So this is where my ENT partners are extraordinarily important in this. The minute I see everyone's like super highly sensitive to food, the next step is, hey, Dr. Tran, he's on here. Hey, I need to get a sinus evaluation or something like that, right? Look at the airway first when you have food sensitivities. And this is also relating to histamine activation, mast cell activation, stuff like that.
My goodness. Do you think the generational trauma, like people in our family members from the past that have been through very, very traumatic situations, can we carry that on physically in our body?
Yeah, we better. I'll tell you why. Our species is Homo sapien. We have these things called complementary DNAs, which scientists used to call junk DNAs because they didn't know what it used to do. And these complementary DNAs get flipped up and down, off and on, whenever there's a sequence that occurs, usually with experiences, right? So what happens is that these complementary DNA, we're getting from both sides, mom and dad, right? Multiple generations. So what happens is we're the product of multiple generations of traumas. And we didn't have traumas, we wouldn't be alive, right? Homo sapiens will be extinct, right? That's true for all organisms. Doesn't matter if you're an amoeba or if you're a human or a monkey or a bird, right? And so what happens is these generational traumas shouldn't be seen as something that's good or bad. They just are, right? So my father, my grandfather went through the Chinese Cultural Revolution. We're a multi-generational physician family, and during the communist takeover, the intellects and the doctors were tarred, feathered in jail, like most of my family, right? And so that's a trauma that propagated my grandmother to go into kind of survival mode, right? All these personalities you see are from multiple generations of patterning that really occurs. And this something called a 4-generational pattern that occurs, which I won't get into because it's really complex for psychology. But what happens is that these traumatic states gets carried into our bodies. They could be chest pain, back pain, foot pain, et cetera, right? And when you combine multi-generational trauma with the fact that our mouths are getting smaller, right? Skull formation is different. You have a physical phenotypic issue plus multi-generational experiences that's conglomerating into the human that we are now and our kids and stuff like that, right? And so I think multi-generational trauma, because we're here, but you can reframe your multi-generational trauma as well. And that's what I'm really passionate about. I have a whole new tech startup that's actually developing this, but we're actually training AI to decipher into multi-generational traumatic patterns to help with patients. Nuts thing. But what happens is we have to ask the bigger question, right? The bigger question is, if I am the product of multiple generations, do I have to blame myself for this?
Oh.
The answer is usually no, right? And that's how you reframe that, because even though you have multi-generational trauma, when you flip the script on the trauma, it stops in your generation, and your next generations can believe different things, right? And
I hear that we do that out of love.
We do what out of love?
Guilt ourselves into being like them.
Oh,
because we love them so much.
Of course. And it has to do with modeling, right? We model who we love, right? We're also at the mercy of what we're shown in our reality, right? So I didn't plan on talking about this discussion.
I know this is not even our topic, but I just
good. So we're actually starting a psychedelic therapy center in Houston here in my facility, actually next week. But we're we actually get into a lot of traumatic state, especially with airway patients too, right?
Mm-hmm.
But yeah, that really helps with the chronic disease pattern as well.
Yes, I have several patients that have been coming to me recently that I'm just catching like, oh, emotional trauma. We need emotional releases. So what can we do for emotional release? First month.
Tongue tie will not release your emotions. Tongue tie release will not release emotions. Most people think that. A lot of patients think that. So I just want to relate this to tongue ties for a second. So most people relate tongue ties to the genome, the MTHFR, methyl tetrahydrofolate reductase, SNP, think of nucleotide polymorphism. So in psychiatry, you learn that, the 1298C and 677T of MTHFR, one's related to depression, the other one's related to anxiety and bipolar disorder, right? That's psychiatry. And then you go into my wife's an OBGYN and fertility. You go into fertility, it's like, this is associated with, early trimester miscarriages. Cool. All right. And then you go into this functional medicine and holistic medicine. You're like, no, this has to do with people not breaking down folate, so they must take the right supplementation to break out, which I actually don't agree with, by the way. All right. Another big thing.
Okay.
Then you got me with my little AI engine here. I was like, what is the big picture here? I was like, well, MTHFR technically is the sleep apnea gene, right? So sleep apnea is the number one risk factor of early preterm labor in OBGYN, is the number one risk factor for depression, anxiety, ADHD, right? Et cetera, et cetera. So the question is, are we just calling this MTHFR gene because we associate it with a methylation defect, or is the methylation defect because we have airway obstruction? So my argument, let's start with the airway in the first place, right? And so
Wow.
this is the problem with science, is that whoever's the first to discover something, whatever field, just calls it that. You're like, okay, well, it's because that's folate. Well, not necessarily. You have to breathe, right? You can methylate just as good by breathing than you can take an L-methylfolate. You really could. Now, does it say it doesn't work? No, it works well. People feel better with it. And then, but some people will take it so much, they what's called over-methylate, where they get a little anxious, B vitamins. That's because you're taking it, but your airway is so obstructed. If your airway is still obstructed, you're going to over-methylate, right? And so that's the issue right here with functional medicine, is that there's always that little caveat that's right here that we have to kind of see everything else. So I don't really feel there's a best type of medicine. I just think that we should really all work together and just give each other great big hugs.
That is incredible. We're having people ask, can you come on at once a month to hang out with us? Yes. Oh my goodness. This is so interesting. Medicine said, you're speaking my language. So many symptoms, syndromes, psych relations that need to be connected and talked about. This is so good. Yes, I know that we have so many questions, but we have reached our time, everybody. Dr. Ron, you are incredible. Blows my mind every time.
Thank you so much. Appreciate that.
Thank you for being here.
My pleasure. I had a lot of fun. I appreciate you.
This is awesome. Let me give some announcements for next week if I can find my other screen right here.
I'll wear my glasses.
Everybody, and please share this. It's going to go straight into our membership. So if you're not a member, join us today. I posted the code below with the discount. Next week, we have Dr. Mike Patton. He's a holistic chiropractor. So next Thursday at 8 p.m. Eastern Time. If you are a healthcare professional, join our Facebook group and stay informed on the next speakers. We also have a newsletter on our website that you can join us. And then we also have a new course coming up called The Foundations of Orofacial Myofunctional Therapy. Starts August 1st. The girls will post the link for our wait list. We have a new podcast called The Beauty of the Breathing. We've had a fantastic start, lots and lots of downloads. They're a little bit shortened versions of our Airway Circle, where we get to ask questions for about 20-30 minutes, and it's absolutely fantastic. Dr. Ron, thank you. I cannot wait to see you again. Can you please share with everybody right before you go?
Yeah.
How can people get in touch with you?
I'm still here.
Can you guys hear me? Okay, I totally came out I don't see it, the screen or myself anymore. But can you okay? Can you share with everybody, if you don't mind, how to get in touch with you?
Yeah, I think most people on here are professionals. So find me on LinkedIn. It's my name, MD, ChenGruan. I have the same tag on Instagram and Facebook as well. I don't do TikTok anymore for ethical reasons. And then you can find me. So my practice is Texas Center for Lifestyle Medicine. And then if you're a healthcare professional, I have a nonprofit organization. We actually raise funds for mental health services that are anonymous for physicians and other healthcare professionals. That's Physician Transformation Institute. And we actually have our retreats every year. Our next retreat's in 2 weeks. Usually we're full. But it's a spiritual consciousness awakening psychedelic retreat. A touch of AI in there as well, which we have every year. Might have to have it 3 times a year now. It's a giant.
Yes. And is that for everybody or just professionals?
Just that one, just for like healthcare professional.
Okay.
The thing that I'm studying is actually for everybody. We're launching that pretty soon. We're about to have some local retreats in Houston, actually in like Livingston, just north of Houston over there. And so a lot of things to look at. But if you follow me on LinkedIn, I actually post all that stuff.
Okay, awesome. Yes, if you can send us some links, we'll post on Airway Circle. Everybody, thank you so much. Yes, if you're on Airway Circle Professionals, we're going to post all the links over there for you guys so you can follow along Dr. Ruan. You are fantastic. Thanks for all the work that you are doing.
My pleasure.
I know that you are helping so many more people that, we can even imagine. So thank you. Everybody have a wonderful night.
Good one.
See you next Thursday. Bye-bye. Thank you for joining us on another insightful episode of the Beauty of Breathing podcast. Make sure to join the conversation on our Instagram page, Myo Moves, and continue exploring the fascinating world of airway health with us. Until next time, let's breathe deeper, live fuller, and discover the beauty in each breath. Quick disclaimer: the Beauty of Breathing podcast has been produced for entertainment, educational, and informational purposes only. All of the content, views, and opinions shared by our hosts and guests should not be a substitute for medical advice. Please consult with your healthcare professional for any medical questions.